of how factors outside of medicine and surgery have drastically affected how we work. I have a little bit of an interest in healthcare policy and healthcare economics, and that's where this comes up. These are my disclosures. The only one that potentially could be effective is this is a new small startup that is looking at a new technology for developing cervical and lumbar artificial discs, but we haven't even done biomechanics studies yet, so probably nothing. So what I'm going to do is I'm going to look at what the spine implant market looked like in the late 90s and early 2000s and see how that sort of led to what's happened today. And also, did we learn anything from all this? Are there things we can do? In economics talk, we talk about what is a bubble. And a bubble is where asset prices rise above their intrinsic value. Those of you who lived through the mid-2000s with everything that happened with the world economy will understand a little bit about bubbles and this concept of irrational exuberance. And my thesis in this talk is that what we saw in the early 2000s was a bit of a bubble. This idea of where motion preservation was going. And I want to look at how it started and what happened. So let's look at spine surgery in around the year 2000. There had been an unprecedented growth in the market for spine implants. The spine implant market went up by a factor of about 8 in a 10-year period. The first total disc replacements were in trials and in some countries now coming to clinical use. And many other motion-preserving technologies were coming through. And so this was a really, really exciting time to be a spine surgeon because the future looked incredibly bright and that we were going to solve all sorts of problems. This is sort of looking at what the market did. This was the market for hip and knee, which was going up, but an absolutely exponential growth. And in 2005, this was an older slide, it actually crossed in 2004 that the implant market, spine implant market became bigger than the market for total hips and total knees. So this growth, absolutely unprecedented, and people were paying attention to this. So between 2000 and 2001, there were 43 new motion-preserving technologies introduced, either to clinical or at least, looking for funding, which is where a lot of this comes from. And this is the thing that started getting a lot of people interested. In a three-year period, there was over $1 billion in acquisitions for total disc technologies. ProDisc was purchased from Spine Solutions by Synthase for $350 million. Charité DePuy bought that from Link for just the lumbar for $325 million, Maverick, Flexicor. So industry was investing huge amounts of money in these implants. And you talk to the companies, they figured that once they bought the implant, they're doing the trial, training the surgeons, marketing, cost roughly triple. So Charité, DePuy spent over $1 billion bringing that to market. So every good story has to have a villain, so I'm going to posit here that the villain is a group called the Viscogliosi brothers. This is an investment banking and venture capital firm based in New York. In 1999, they predicted a massive increase, or sorry, I'm incorrect there. 1992, they put out a paper that predicted a massive increase in the amount of spinal surgery implants, and everybody thought they were crazy. There is no way the market is going to grow that fast. And by 2004, it showed they were correct. And there were a bunch of factors that went into that, and the biggest of them was ending a lawsuit in the United States against the manufacturers of pedicle screws. Because up until then, manufacturers couldn't teach pedicle screw implant, and a lot of surgeons were reluctant to do it. Once those lawsuits were settled, the market took off. Now, this was not something that was predicted, and this was an unusual sort of growth. And in 2004, they brought out this analysis. It's a big book. It's about that thick. I actually have a copy of it, where they called Beyond Total Disc Arthroplasty. And this was sort of their follow-up to their 1992 report. And so the end result, when you looked at this, in an era, at that point in time, there were approximately 200,000 instrumented procedures being done in the United States per year. And they predicted that by 2010, 6 years away, that motion-preserving technologies were going to create 800,000 new indications for surgery, every one of them having an expensive implant put in. So what happened here is the health policy people went, whoa, We've already got exponential growth in the market. This is already hugely costing the system, and they're predicting 4 times increase in volume again with more expensive implants than we were using. That got a lot of people's attentions. Now, I'm going to go back. Again, we got to talk about the villain here. The report quoted at length several prominent spine surgeons, all of whom had financial interests in the products that they were promoting. The Viscogliosi brothers were the primary funders of Spinal Solutions and Paradigm Spine and a couple of other spine companies. They were the people who were raising the money. And their payment structure for the Spinal Solutions and for the Paradigm sale included, they got extra payments based on FDA approval and sales targets. So they were going to get more money the more sales they could generate. So let's go back to the early 90s. The early internet era, we had all of these companies called, they were pump and dump schemes, where what would happen is somebody would get on the internet, they'd promote a stock, any stock, started as a penny stock, gets up to $1, they'd sell off, and they called it pump and dump. And this was illegal. Many people went to jail for that. And really, when you look at the Viscogliosi brothers at this point, other than a Manhattan address and $1,000 suits, were they doing anything different than these internet pump and dump scams? They were pumping up demand for a product so that they could make more money when they sold. So moving on, what happened? October 2004, September 2006, the first 2 discs get approved in the United States. In May of 2006, the Center for Medicare and Medicaid Services, so you got to understand a little bit about how American health policy works. If you are over age 65, your insurance is Medicare, which is a government-funded system. They can control where they spend their money. And so they looked at all this and they went, hold on, first off, if you look at the trials excluded anybody over age 65. So this is not a product that's approved for our market group. And so based on that, they came up with what was called a non-coverage determination. They said that Medicare will not pay for these devices. Well, a lot of insurance companies base their coverage based on what Medicare says. So now all of a sudden a lot of insurance companies are saying, oh, we're not going to cover it either. Because remember, they're looking at this potential overgrowth in the market, this exponential growth, and they're worried they're going to go broke because of all these implants. So what happens then is the market did not take off as projected. And that the sales of lumbar discs were very, very slow, and they didn't grow, and in fact started to drop off after the non-coverage determination. To the extent that Stryker and Medtronic finished their trials and completed them, but they did not even go to the FDA to get these approved for marketing because they felt there wasn't enough market that it was worth that 3 times extra in for surgeon training and things like that. They would not recoup the investment, and Medtronic wrote off $1 billion and never brought the implant to market after spending $1 billion on it. So what happens? Again, the insurers saw this huge potential cost increase. The non-coverage determination gave them cover to say, hey, we're not going to cover this. And it became impossible, really, to get insurers to pay for artificial discs. So the market disappeared. Then, of course, the insurers also started looking at the data on fusion in the absence of instability or deformity. And they started even questioning whether they should be paying for fusion. And now in my center, for a lot of indications, I have to get on the phone with the insurance company to get approvals for a lot of the fusions that I want to do. I have to be able to justify them why this patient needs a fusion. So if you looked, this is, again, the predictions. They were saying that in 2010, only full portfolio non-fusion companies will survive. The only companies that are going to survive doing fusion were going to be Medtronic, Synthase, and DePuy. That they felt that, that disc replacement and posterior stabilization markets, so this is what they were predicting, and as you can tell, none of this has happened, really. So this talk I originally gave 2 years ago, but the reality check, if you look now, and particularly the American market, virtually no use of lumbar total disc. You would hear people say a young athlete is a good person for a lumbar total disc. Rick Geyer still does total discs, and yet when Tiger Woods came to have surgery, what surgery did Tiger Woods have? Tiger Woods had a standalone ALIF. Cervical total disc replacement, totally different. The market is getting bigger there. More and more people are doing it, again, in selected patients. DNASYS. DNASYS came, and the way the trial is done, or the way an IDE trial is done in the United States, is it's a non-inferiority trial. All you have to do to get it to market is say it's not worse than what's going on now. So the DNASYS trial compared fusion to dynamic stabilization, and they weren't even able to show it was as good as a fusion, and the FDA denied approval for non-fusion implant. No nucleus replacement has even come to the FDA for approval, and interspinous spacers are at best a small niche market. And again, the Maverick data actually showed superiority, or reportedly showed superiority over fusion, and yet they didn't even take it to market. And no facet arthroplasty. There is one. The TOPS device is now in an IDE trial. My center is actually an investigational site for it, and I'm actually one of the investigators. I'm trying to do some. So again, what really happened? Well, a bunch of things happened. Insurers made it a concerted effort to deny payment for discs. Interspinous spacers really haven't panned out in the long term. A big part, as we looked back on it, was the realization that a lot of the reason for failures in surgery for low back pain is we don't know who's going to benefit from surgery. Most of the patients who are having surgery for low back pain in the absence of instability or deformity weren't doing well because we weren't picking the right patients. We don't know enough about that disease. Low back pain is a symptom, not a disease. There are many causes, and a lot of those causes will not respond to surgery. And if you look at lumbar total disc arthroplasty, that was the target group, the low back pain patients. Because if it was stenosis, you would do a decompression. In the cervical spine, the reason that artificial discs have taken off is because there the indications for surgery are much more defined, and the total disc arthroplasty has a role there. Also, we began to realize that adjacent segment degeneration may not be so much a problem with fusion as the alignment that we're fusing people in. And this is the big thing, that all of this led to the insurers and the government looking much more at cost containment and trying to bend the cost curve because they were projecting that this could bankrupt the country. So the flaws in the logic, there was a huge potential market for motion-preserving technology was based on radiographic and anatomic progression of disease. There's this idea that, okay, early stage degeneration, we can do this. And the problem is we all get that early stage degeneration, and most of us aren't going to be symptomatic. But they were postulating that basically the market was everybody, which isn't true. Patients present with symptoms, not degenerative change, and we're treating the symptoms, not the MRI. So by the time they get to the symptomatic, they may not be a candidate. Discs and hips are not equivalent, and that motion-preserving technology may not prevent. So where did we go wrong as a profession? The industry was driving change. We weren't driving it. The startup culture, people were making boatloads of money off of this. Many of the people who were standing on podiums like this had conflicts of interest. That's why we're now all having to put disclosure slides up. And it was a technology in many cases looking for an indication. What did we do right? And we did do some things right throughout this. We kept looking at the results. So we were questioning our own data, which is a good thing. We were being skeptical, some of us. We recentered things on patient-reported outcomes. Started looking at how the patients did rather than their x-rays. And I think through this we have regained a degree of skepticism, and we're less ready to blanket accept new technologies as being a good thing. And so the fallout, Charité, when DePuy bought Synthase, they abandoned Charité completely after spending over $1 billion. None of the management of DePuy that were around at the time survived. They were all fired. Medtronic and Stryker each wrote off over $1 billion investment. And insurers have now made it much tougher for us to do our jobs. So how can we prevent this from happening again? Always put the patients first. We're treating them. Always be skeptical of new technologies. Always look at